As this generation continues its fight against the coronavirus, concerns are growing about the next generation. Some, like this medical worker, are staying on the front lines, despite being pregnant. Others are putting off their dreams of parenthood until a treatment can be found. Some had predicted a baby boom during lockdown, but initial research suggests US birth rates have fallen. That leaves many wondering what long-term effects COVID-19 could have on fertility rates. Some of my friends have been through stressful times. Others have coasted through this crisis, making the most of taking it easy during pregnancy. And many more are delaying their plans to make a family. Google searches for terms like morning sickness and pregnancy tests have fallen. Scientists say the data collected point to a 15% drop in birth rates in the United States in the coming months. The picture varies around the world, but all in all, it looks like fewer babies, a higher impact on the well-being of new mums, and effects on older generations further down the track.
A month before this moment, Maria Alvarez lost her husband to the coronavirus. Herself infected but asymptomatic, she gave birth in a Peruvian hospital, surrounded by doctors whose faces she could not recognize behind their protective gear. It's just one experience of giving birth during a pandemic. For most women, the conditions will be far less tragic. But still, researchers believe the coronavirus could have an impact on family planning, with women choosing to delay having children while the virus and the economic uncertainty that accompanies it continues to reign. This could intensify an already worrying downward trend in the global birth rate. For the past several decades, fertility rates worldwide have been in decline. But there are major regional differences. In Niger, for instance, the average woman will still give birth to 7 children in her lifetime. In Germany, it's less than 2. That has given rise to grave concerns about society's readiness to provide for rising numbers of elderly people whose pensions need to be financed by an ever-shrinking workforce. The problem is already well known in Japan, where 1 in 4 people are over the age of 65. Experts say previous pandemics, like the Spanish flu in 1918, provide only limited clues about what to expect this time. The global birth rate did fall in 1919, but this was followed by a baby boom the following year, usually attributed to the end of World War I. It's far from certain whether a similar boom could follow the coronavirus. The pace of an economic recovery and the search for a vaccine are both likely to play a role. But demographic trends are one thing and personal stories another. Holding a healthy baby girl in her arms, for Maria Alvarez, memories of giving birth during a pandemic will forever be laced with both tragedy and hope.
Let's talk about making babies with Nathalie Nietzsche, a fertility researcher at Germany's Max Planck Institute. Nathalie, will birth rates really fall? Because a lot of people have had a lot of time on their hands during lockdown.
Yeah, I know. I read the media reports as well. And while I'm sure there will be some lockdown babies born, that as a major trend to affect future fertility rates is extremely unlikely. And I would say, yes, birth rates are going to fall, at least in the next few years or in the next year. Let me tell you a bit more about why I think, yeah?
I was just going to say, we're talking globally, I guess. Are there differences between poorer and richer nations?
Most likely we will see differences. I was just about to talk about the higher income countries, for example, Europe, North America, Australia. In those countries, we are seeing the lockdowns, we are seeing recessions. And we also know from previous research that pandemics and recessions cause fertility to fall, at least for a while. So some studies have been conducted that asked people across European countries on their fertility planning, and the great majority were planning for in 2019 said that during the lockdown they have changed their mind and they are now either postponing the baby making abandoned these plans altogether. There's a few minority of people that said they changed their mind and they wanted a baby now, but this is just a small portion of couples.
Are these changes or trends likely to become permanent?
Well, that's a very difficult question. Nothing is permanent in fertility, so that's one of the features. It's constantly changing along with social change. Classically, after recessions or pandemics when fertility fell, it has rebounded after about 2 or 3 years. But what happened after the last recession, we had the Great Recession in '08, was that fertility rates fell and kept falling until basically today, in some countries at least, like the Nordic countries or the US, which has puzzled fertility researchers to begin with. And now this pandemic is falling on top of declining birth rates in some high-income countries, and it's unclear how the trends will actually look like longer term.
The reason I'm asking is because a lot of people believe this planet is full. And what's happened now with this pandemic is we've had social distancing and people realizing we need even more space. And, the question is whether or not we have that.
Well, that's of course interesting. And I think there are a couple of factors that we are right now discussing that will likely have an impact on fertility. And the social distancing, I think, is something we can't really measure the effects of yet, but we can think about that. And of course, for baby making, physical contact is necessary. And we are thinking that fertility will be impacted by changes in relationships. For example, single people who are not finding partners perhaps right now, or couples that split up after the stress of the lockdown, that will likely have effects on fertility that we can't really say how they will look like now.
You mentioned the physical effects there. What about the mental and emotional factors involved?
Yes, mental health has been impacted negatively by the measures and the lockdown. And there is a correlation between mental health and fertility, which is a negative one. So that could go through the union formation or through the partnership stresses. That could also decrease the interest in having a child to begin with. It's not clear how the direction of this effect looks like, but I think it will play a role in future fertility. Also, you asked about the global impacts, and I think what is going to be really important in predicting how fertility will develop in the lower income countries is how the culture of these countries will provide perhaps a filter that moderates how the recession and the health effects of the pandemic will affect fertility. For example, I'm thinking about things like risk-taking or emotional coping that could be handled differently and by the populations on average in these countries. And there's very little research on that. And we are attempting to look into this into the future in our research.
From Germany's Max Planck Institute. Thank you very much. Good talking to you. And let me hand you over to our science correspondent, Derek Williams. He's been looking into some of your questions on the coronavirus.
In an electron microscope, SARS-CoV-2 and flu viruses look alike. They both have a corona. So why isn't flu a coronavirus too?
I understand your confusion. Maybe it makes the most sense to explain by drawing a comparison from the macro world that we live in. Sparrows, for instance, have wings and they have beaks and they have feathers, and so do eagles. Would you call them the same thing? You can't judge evolutionary relationships based on just one or two apparently shared traits. In virological terms, although influenza and coronaviruses are both single-stranded RNA viruses that bear spikes on their outer surfaces, that's pretty much where the similarities end. The coat that surrounds that genetic material in the two groups is, for example, made up of very different proteins, which interact also differently with our cells. And that genetic material itself is very different. Coronaviruses are much larger than flu viruses, and their RNA is made up of around 30,000 base pairs in a single long strand. That's more than twice as many as make up the influenza genome, which consists of sort of several distinct segments. The way the two species replicate inside of our cells is also different, and flu mutates a lot faster. So don't be fooled by appearances. Coronaviruses and influenza viruses are two very distinct groups without a lot in common other than a vague visual resemblance in an electron microscope and the fact that they both cause respiratory infections.
I thought eagles and sparrows were pretty much alike. I know they're birds, and I know we're full of viruses. Well, just finally, before I let you go, churches are open again for Mass in the capital of the Democratic Republic of Congo, but with a few new COVID-19 inspired rituals. At this church in Kinshasa, priests and religious leaders walk through a decontamination tent and wear face masks and shields. More services are being offered to allow for fewer people at each service. Parishioners are encouraged to wash their hands upon entering, wear masks and social distance even in the pews. In South Korea and many other countries, churches have been criticised for causing so-called super spreader events where dozens, in some cases hundreds of people have gotten sick from an infected individual. By comparison, the average coronavirus patient infects just 2 other people.